there are three sets of grafts that are most commonly used in rhinoplasty, that I use most commonly. One is termed spreader grafts, the other is called lateral crural strut grafts, and the third is columellar strut grafting. All three have different purposes and address different parts of the nose. I'll start with the spreader grafts, which are one of the most common ones used. And in fact, all of these I use commonly in primary rhinoplasties, certainly in secondary rhinoplasties. Spreader grafts are little shims of cartilage that are harvested from the septum, which is the keel in the middle of the nose, part of the septum that's not necessary for function or for form. We take that cartilage and we cut it up into small slats or staves, depending on the size and the shape that we need. And the spreader grafts are two that sit on either side of the septum in this area. Their function is to open up what we call the cartilaginous or middle vault of the nose. We want this part, the cartilage part of the nose, to match the width of the bone part of the nose, which in a rhinoplasty may also be narrowed if the nose is wide. But the ultimate goal is to have this bony vault match the width of this cartilaginous vault. Once the bony vault is set, and we narrow the bone to the degree that we want, we then use these spreader grafts to widen this part of the nose to match it. That has an aesthetic outcome because we want the shadow line that extends from the top of the nose at the eyes all the way down to the tip of the nose. We want that to be a smooth line. That's the aesthetic ideal. Those are called the dorsal aesthetic lines. The other reason for the spreader grafts is to open up the breathing passages, because this middle vault is where the air flows through. It comes up through the middle vault. So those little shims of cartilage open that up. Those are spreader grafts. Lateral crural strut grafts are primarily used as a reinforcement, as I referred to before, that we've taken all of this soft tissue apart and all of this structure apart. Now we're going to put the soft tissue back on, and that soft tissue internally is going to scar, and we know scars contract and move, so we've got to reinforce and solidify our structure to withstand those forces. Lateral crural strut grafts are grafts that just do exactly that. They're small, again, shims of cartilage taken usually from the septum. There are other sources if we need them, and there's no septum left. And they're put right across this part of the cartilage here, which is called the lateral crura, and they reinforce the lateral crura. The bottom of the nose, we call it a tripod. There are two pods going this way, two legs going this way, and then there are two that form the middle pod of the tripod. And if forces push the tripod one way or another, or there's a buckling of one of those pods, the tip of the nose shifts. The lateral crural struts are meant to reinforce these two pods. You can imagine a stool with one weak leg, or some force trying to pull that leg down. We're using those lateral crural struts as a way of reinforcing those legs. And then the last graft that I mentioned, which is the columellar strut, is exactly that. Again, a reinforcing strut, a shim of cartilage that goes to reinforce that middle pod. It sits right between the two cartilages that make up the middle portion of the nose, the columella. So that's called a columellar strut. Those are the most common grafts. There's a myriad of other grafts that are used, but in a primary rhinoplasty, those are almost always used. So it depends what the goal of your cartilage graft is. If they're structural, as I discussed just now with spreader grafts, lateral crural strut grafts, and columellar struts, then you need hard, firm, strong cartilage to withstand the forces of the contraction of the scar, etc. The septum is your best bet because it's like with like. That's the type of cartilage we want, is nose cartilage, strong nose cartilage. If there's no septum, the ear provides cartilage, but it doesn't have the same strength. And so really, if you want something good and structural, the rib is your next best bet. Now, rib grafts have a bit of a problem because rib grafts are like carrots. In fact, rib cartilage very much looks like a carrot, except it's white, not orange, of course. But you know that if you try to peel a slat off of a carrot or take a slice of a carrot in a longitudinal fashion, which is how these grafts are required, we need long grafts, it bends. If you take it off the top of the carrot, it's going to bend towards the top of the carrot. If you take it off the bottom, it's going to bend towards the bottom. So there are a number of methods to try and stop cartilage from bending. And in fact, we're just working on a paper now, hopefully to be published in the near future, that is an innovative and new way of harvesting rib cartilage, where we have shown, we've now got over 100 samples that we've had in the lab cooking for 4 weeks. We now have shown that the way we harvest the cartilage, the way I've been doing it for now probably close to 5 or 6 years, there's absolutely no warping and no bending. This is a huge advantage in secondary rhinoplasty because, as you mentioned, often in a secondary rhinoplasty the septum is gone. Somebody's already harvested that septum and used it for their first operation. And we need a good source of structural cartilage. So by using this particular method, which actually I just presented at the Canadian Society of Plastic Surgery in Montreal this past summer, we now have a method of obtaining rib cartilage, and we can sort of rest assured that it's not going to warp over time. So it's a good way of ensuring, once again, predictability of the